My name is John Bosworth. I am a licensed mental health counselor in private practice in St. Pete, Florida. I'd like to talk a little bit about the differences between a psychiatrist and a psychologist. Many times throughout my career and through teaching as an adjunct at University of South Florida in Tampa, many of my students will come to me in my introduction to the profession of counseling class and ask me, what's the difference, John, between a psychologist and a psychiatrist? And I try to explain that, many people think that they're really the same thing. And probably 20 or 30 years ago, psychologists and psychiatrists did the same thing. But nowadays, it seems that the psychiatrists are more geared toward just writing prescriptions for psychotropic medication, whereas clinical psychologists gear their work more toward counseling and therapy. With that said, the differences in education are most clinical psychologists in most states have to have doctoral level training, whether that's a PhD or a PsyD from an accredited university through the American Psychological Association. Psychiatrists, on the other hand, they have to have an MD minimum, a minimum degree of an MD from an accredited university by the American Medical Association, and then they also have to do, I'm not sure the actual length of requirement, but they have to do a residency, which is part of their, their formal medical training under qualified and licensed psychiatrists. And then their training basically goes, continuing education goes in different ways. Psychiatrists can work more on the psychopharmacological side of it, and then clinical psychologists usually do continuing education in theory or counseling techniques or whatever their particular area of interest might be. And the difference in salaries can be great, although there are some clinical psychologists that make more than a psychiatrist might, depending on working conditions and location. Most psychiatrists tend to make a little bit bigger annual salary, kind of commensurate with other, medical doctors. Their malpractice tends to be a little bit higher, tends to be a lot higher depending on the setting they're working in, whereas clinical psychologist malpractice tends to be a little bit lower. The only other difference may be that clinical psychologists can work in the hospital setting and, along with a clinical psychiatrist, but most of the emphasis and the difference between them is that the clinical psychologist definitely tends to gear their practice more toward counseling and psychometrics, whereas the MD or the psychiatrist tends to gear his practice a little bit more toward medication management or psychopharmacology. My name's John Bosworth, and we're talking about the differences between a psychiatrist and a psychologist.